Hey, welcome back, everybody. It's time for another episode of Tomii Healing and Wellness. The one show, maybe the only show, that shows you some alternative paths to healing and wellness. Some of them have been well-trodden for a long time, including this whole idea of Chinese traditional medicine, which we're going to explore today, and a part of it that we don't often hear about. I think it's called AV therapy. We'll find out more from our guest here, a practitioner of integrative medicine. Bridget, welcome to the show here today.
Thank you very much, and thank you very much for inviting me to speak with you today.
Yeah, so is it Bridget Goodwin, right? Is that the correct?
Yes, that's fine.
You have a practice in Australia, down under, and it's always strange to do shows with people because you're the woman from the future. It's Friday. It's tomorrow already in Australia. What's tomorrow look like for all of us back here in the past?
Well, it's very bright and positive, and I hope things improve for people in the LA with these terrible fires you're having.
Our hearts are out to everyone. We're taping this in the early part of January for those hearing it in the future of 2025, where unbelievably, the Hollywood Hills and the surrounding areas have caught fire and turned into a major fire in what would normally be a quiet winter for us. This is not when the Santa Ana winds come and whip up these sort of fires here. So our hearts are out to everybody there who's going through that. But down in Australia, things are okay today. It's your winter, or it's your summer down in Australia right now.
Yes, it is.
All right, so let's rewind this thing. We're going to try and unpack all of this. You epitomize to me what this show is all about. Other ideas, alternatives to traditional medicine. More and more people are looking beyond Western medicine, which has miraculous cures. You want to replace your heart, you want to replace your knee, great. But if you got a chronic condition, a pain, a problem, a persistent illness, diabetes, cholesterol, pains that won't go away, Western medicine doesn't seem to have all the answers. They got a pill or a procedure, and if it doesn't fit into one of those two pigeonholes, it's hard for them to handle this thing, right? So that led you into this world of what they're now calling, instead of alternatives, more integrative. How do you define integrative medicine?
Well, I think integrative medicine is the term that people use when they used to say alternative medicine, because I think, as you say, Western medicine and many doctors have started going back to traditional medicine, learning the natural medicine methods, and also natural medicine has gotten itself very much more professionalized and proven that many traditional practices are effective in science, because for a long time traditional natural medicine has been kind of
dismissed. Exactly.
It's not being scientific, but it's actually been proven to be not just scientific, but very much more effective than a lot of Western medicine. So integrative doctors are more and more learning, going back to the traditional ways. And I think that's very much a trend that's booming along, just as you say, when people can't find answers for their serious health issues in existing pharmaceuticals, they start looking beyond that.
Right. So let's look beyond that a little bit here. We've had people on the show in the past who are now called naturopaths. That might mean a practitioner like yourself who maybe has a PhD but not necessarily a medical degree, or it can include doctors who actually do get a medical degree and then choose not to be a family physician or something else. They look at natural remedies to supplement or replace pharmaceuticals, right? Is that kind of what you're doing? You're using plant-based, natural-based remedies?
Absolutely. I mean, my story begins with apitherapy, when I accidentally reversed somebody's skin cancer using bee products.
Wow.
And I really had to know more, and I started studying apitherapy, which is medicine from the beehive.
And this is API therapy, because AP is, I think, a Latin or Greek for bee or something here.
That's right. But as it happens, AP therapy has been practiced within the context of traditional Chinese medicine for possibly 4,000 years.
See, I didn't know that. Did you? We're with Dr. Chen, who sits silent through much of the show here. English is not his first language, but you've become obviously your own practitioner in Chinese traditional medicine. Did you know that bee therapy was part of traditional Chinese
Yeah,
therapy?
I heard about it.
But you haven't used it. You don't use it
No, I
yourself.
haven't used it.
All right. So this is, and explain to us what it is. You somehow use the sting of the bee or some other part of the bee or something here?
Well, actually, all of the bee products are medicinal. So there's the sting of the bee, which is bee venom, which is used in traditional Chinese medicine clinics in China, in hospitals, as part of the medical system, and has been for a long time. And I've been to China to study how this is used in the hospitals, which has been great. And I've done an apitherapy diploma in China, in Beijing,
Wow.
because I was so intrigued by that.
And what would
And
they use? Let's just focus on that for a second. What would they use a bee sting for? Do you actually put a bee on somebody's knee? I've seen examples or videos of this, and invoke the bee to sting the patient for what?
well, in Chinese medicine, they call it bee needle, and they use it in the context of acupuncture in the many, many applications that acupuncture is used for, which can be anything from arthritis to asthma to hay fever to many, many health issues. I've seen people in China being treated for multiple sclerosis, for Parkinson's,
Wow. And
and cancer.
just like the needle, somehow you're redirecting the body's energy, or you're focusing the energy at a certain particular meridian, a point of the body here, right?
That's right, onto acupuncture points. And I think that it's regarded as a natural sterile injection. And in many other countries of the world, bee venom is being produced as a pharmaceutical injectable. But in China, because it's been so accepted for so many thousands of years, the bees are contained in little bee boxes on the trolley in the hospital, along with anesthetics
Oh
and
my goodness.
band-aids, and they're just part of the medical system. And when the doctors need more medicine, they literally step onto the balcony, put a net over their face, and grab some more bees from the beehive.
Oh my goodness. That's hard to imagine. I've seen all these medical dramas. America's filled with them. Suture, bandage, bee. Hand me another bee here. Now, what do you do? My first question, I got to get it out, is my wife is horrified. She thinks she's allergic to bees. She doesn't know, but for some reason she's convinced herself she's allergic to bees. Many people are, and they have to carry Benadryl or Epi shot to counteract that swelling of the face, swelling of the throat, potentially life-threatening side effects of a bee sting. Is that of concern, or how do you deal with that?
Well, definitely, in the training in China, the safety is very strongly emphasized. And yes, it is a potential. However, I mean, I was told I was allergic to bees when I was stung by a bee on the ankle when I was 18, and my foot swelled up a little bit.
Right. I think that's what happened to my wife.
Because I think
So, right.
we're all told that we're allergic to bees when that happens, because I think we don't understand. But yes, it's a concern, and we have to be careful that people are not allergic, which you can do with an allergy test. But that actually, but true allergy is actually anaphylaxis, when your throat closes over. That's
Right.
true allergy.
Right.
So when you're having bee venom therapy for different conditions, you can get a little bit of swelling, particularly on the extremities, on the hands and feet. But when you study this medicine, you learn that the swelling is actually part of the healing process, because the bee venom triggers an immune response in the body, and your own body starts repairing. So it's a bit hard to explain, and I have to speak about this a lot, because everybody's been told they're allergic to bees,
Yeah.
and
Right.
we're not very familiar with this. But it's not just the bee venom that's medicinal, it's also the products that the bees make, the honey, the propolis, the royal jelly. All of the bee products are
What's the
actually
royal
medicinal.
jelly? Is what they make it for the queen or something here? It's
That's right,
supposed to
yes.
have
And the
some
queen,
special ingredients and
yes, the bees make special food for the queen, and the worker bees live for 30 to 40 days, but the queen lives for 7 years. So royal jelly is a highly prized longevity medicine, but it's also can balance hormones, can help with fertility. Bodybuilders like royal jelly to build their muscles. And, a lot of these bee products I like to think that because they're so ancient, they're kind of hidden in plain sight. But now that there's been so much research internationally about the bee products, there is a lot of very powerful evidence about how effective they are.
Well, you obviously believe in it wholeheartedly because not only do you integrate it into your integrative medicine practice, you have yourself become what, the president of the AV Therapy Association in Australia?
That's right. Yeah. Well, I think that I'm the founding president, and I began the association about 5 years ago after I'd been studying and I couldn't believe what I learned. And I had a lot of support from international apitherapy associations.
Hmm.
And I found that apitherapy is actually practiced in 80 countries.
Wow. I was going to say, is this
Uh,
is this accepted practice? Is it banned in places?
Well,
Is it
no, it's part of the medical system in many countries in Eastern Europe. The Russians are very advanced with their apitherapy research. In Romania, um, in Serbia, many Eastern European countries, apitherapy is very well established, and it's only the West, US, Australia, Canada, that really don't know about it, and there's just a lot of work to do to educate people about the potential.
I don't want to offend you, but somebody told me I was going to prepare this that it's illegal in this country. Is it legally practiced here in California, or is that something that's
I
still
think I think the word is not recognized. I think many people, in America, you have a big problem with Lyme disease, and the bee
huge?
venom
Yeah.
therapy is famously one of the few treatments that actually helps
Hmm.
people with Lyme disease.
That's the
So,
tick from the deer that gets on and causes fevers and all sorts of things. And
right. So, if we get back to traditional Chinese medicine and diagnosis, I had a patient with Lyme disease a few weeks ago, and I used the Tomii system to do a diagnosis of him.
hmm.
And I mean, people with Lyme disease usually go all over the world trying to get help
Hmm.
because it's such a difficult to treat
And it's
illness. And
chronic. You don't just get it once. I don't know anybody who had it, but I grew up in the areas where it was prevalent in the Midwest and back east, and it's scary. It doesn't go away, I don't think, or the
so
symptoms can persist. Yeah.
that's right. But so to look at it from a Chinese medicine point of view, using the Tomei system, it's really interesting because that system reveals all of the areas in that individual's body that need some support. And that particular patient was really shocked at the Tomei system, how he said he couldn't believe just from a couple of acupoint on his body with a sensor
Hmm.
that it could do a scan of his whole body and tell him information that he felt was so accurate.
Yeah. I,
He'd
I
never seen anything like it.
That's part of the process, part of the ongoing dialogue of the show, right, Dr. Chen? To remind those who are maybe seeing this for the first time, you yourself were a sensor scientist back in China back in the day and got very sick with diabetes, right?
Yes,
And to the point it was paralyzed you, or you couldn't work.
yes. And back to 1996, when I ran the first software business, I successfully business better than going to the emergency room, stay in the hospital for 2 weeks.
So
with
even though you're in
diabetes.
China, you're going to Western medicine, scientific medicine. You're a scientist here.
Yeah.
And
So,
all they're giving you is what, pills to control it?
yeah, pills, and the side effect are very serious. So
So you
looking for
stumbled back. Somebody said, why don't you look around, like she's saying, it's hiding in plain sight. You're in China. Why not look at traditional Chinese medicine, which you didn't believe in at the time, right?
yeah, at that time I don't believe it.
You're a scientist, right?
I'm a
That's
scientist.
voodoo. That's for the the poor people in the villages here. This isn't real. So you start exploring that out of desperation and really reversed your diabetes, right?
Yes, I use the meridian energy pathway to
I know we
to
can't. We
to
careful what we can claim. This is just your own.
to
This isn't scientifically supported. There is no FDA approval for all this. This is
so
outside the boundaries of Western.
that's why we develop the meridian energy analyzer system to map out where is the meridian and where is the imbalance, where is the blockage.
And that's
We,
what I still find amazing. This must be a very small amount of energy that you're mapping. It's historically people have said you can't. The Chinese believe it's there, and when the Western scientists say where, they say, well, we don't have to prove it. We've just been doing this forever. I don't know. You measure it. You go find it. We believe it's there. and the Western science says, show me. I can't see the blood. I can't see any. There's no detector. You came up with, I think, the world's first detector of this imperceptible amount of energy that's flowing through the body.
We use the sensor, high technology sensor to measure.
Put them on different pressure points.
The current.
Yeah.
The main current.
And then from that, then you had to figure out, what is this telling me? Okay, so this, I see more current here, less current here. Somehow you had to translate that. How long did that take you to figure out the software to analyze this data?
Yeah, we spent more than 10 years to develop this
wow.
system. So.
And how did you find this, Bridget? You through the internet somehow, or you just discovered?
I think I found it doing research, and because
LinkedIn.
LinkedIn? LinkedIn. Okay, the miracle of LinkedIn.
Yeah,
Right.
that's right. I have a huge, tremendous respect for traditional Chinese medicine, and I'd been in China. I think I went 3 times in the first year that I started studying Chinese medicine in China. And then, because it's based on the very traditional method of pulse diagnosis in Chinese medicine, which was when the doctor, they look at your tongue, they look at your eyes,
Right.
they can read because it was developed thousands of years before we had instruments
Right.
and technology. But the pulse diagnosis always fascinated me, because the Chinese doctors can feel, I think, many different pulses, and they have a way to read the meridians through years of study.
But it's more observational. Your tongue tells them something, your eyes other thing. It's not necessarily.
It's observational, but the pulses can be felt. So the Tomii system actually does the work of a very highly evolved traditional Chinese doctor in a hospital by reading, but it goes further than that. It actually produces a computer report and diagrams to show, which I found the patients love to see
Absolutely.
an explanation of how this works in traditional Chinese medicine diagnosis.
Right. Because we all are trained to look at data. We all want to see a diagram. We all want to see a chart that compares before and after and whatnot. And I've asked Dr. Chen this numerous times. I'll ask you, why has Chinese medicine, traditional Chinese medicine, or other traditional Ayurvedic medicine, I think, not found a way to integrate East and West, to find a way to bring technology to bear and to add to what has historically been an art that you have to learn to read people. It's more of a observational art that they have to develop, or maybe it's a feeling or a pulse. But why haven't they brought technology into this in China? Or are they?
Just jump in there and say, there actually have been studies of the acupuncture meridians, and I mean, for many decades, people saying, oh, yes, it's all hoodoo, it doesn't exist. But
Right.
in recent times, in the last few decades, they have actually found those meridians actually exist, and they're there, and they're not our normal nervous system. In fact, one of the most extraordinary images I saw when I was in Guangzhou was at the Traditional Chinese Medicine Museum, where on the ceiling of the acupuncture hall, they've lit up a diagram of a human body with neon to show where all the meridians run. And it's quite a, fabulous image, because they're there.
Well, and there must be something to it, because all of a sudden, Kaiser Permanente or whatever, United Healthcare, they will pay for acupuncture treatment. Acupressure doesn't seem to have the same acceptance as acupuncture. I don't know why. It's a similar thing without the invasive needle. And to me, you also get the benefit of a deep tissue massage, which seems like it relieves knots in your nerves and your muscles and maybe your blood flow too, as a benefit. But whatever it is, they've suddenly started to support some of these things, but mostly just for pain, as a pain alternative rather than pills. Have you seen that grow in Australia? Are they accepting energy treatments, acupuncture, acupressure for things other than pain?
I think acupuncture is very well respected and regarded around the world. And yes, people that have had experiences from acupuncture can speak about their amazing recoveries.
Right.
It's in some ways more subtle than taking, say, an opioid drug where you can feel an effect, like being hit by a rock. You know? But you notice when you have acupuncture for different conditions that you just gradually improve, the same way Dr. Chen, I'm sure, reversed his diabetes using traditional Chinese medicine, but it's also intended to work with traditional herbal medicine.
Yes,
So
right.
there's a powerful combination that is probably not that widely understood.
And
that
that's
it's
what your next phase of research is on. You're actually studying to get a degree in Chinese herbal treatment.
Yeah, there's a combination. Is
That's right. I'm actually, I've been doing a bit of work in Mexico, and I'm actually completing my traditional Chinese medicine acupuncture diploma in Mexico. I'm actually going back to
You're in
do my
Australia
exam.
going to Mexico to learn Chinese acupuncture treatments. This is the
Oh,
new
well,
world.
I mean, I've discovered that when you get involved in apitherapy, it's like permission to see the world, because you have to go outside my country, because my country is very conservative about
Yeah,
natural medicine and it's
right.
not known here. But if you go to Eastern Europe, it's part of the medical system. If you go to China, it's part of the medical system. And in Mexico, as many people in the United States know, many treatments are more freely available in
Absolutely.
Mexico
If you
than they
want to
are in
try
the United
something
States.
that's not looked upon well, or maybe even allowed, drugs, medicines, treatments, we go across the border to Mexico. They have a much more open system about trying all these things here. And I don't know if that's good or bad. I mean, I understand you got to have some control. I think that's what's powerful about the Tomii system. I hope someday the FDA takes a look at it, or somebody can fund the kind of clinical research they'd want to do, because you're getting data. That's what everybody's been missing. Doctors who dismiss all this stuff say, well, yeah, there's a million anecdotal stories. I know it's been done for 1,000 years, but show me the data. And for whatever reason, traditional therapies like Indian Ayurvedic, Chinese traditional medicine have said, we don't need to show you the data. We just believe it works. And we've applied it and practiced it for thousands of years. And I think in this new world of integrating East and West, I think Dr. Chen is the bridge between those two, or a bridge between those two.
Oh, I think it's a very impressive system. But the other issue is the paradigm of assessing things according to Western analysis doesn't really apply because of that fact of the integration. So in FDA, in double-blind trials, they'll be testing one thing,
Right.
one drug, and
Right.
usually it'll cost millions of dollars, and it can only really be financed by a pharmaceutical company who want to patent something
Right.
and make money, whereas traditional Chinese medicine and herbal medicine, it's so many thousands of years old that it can't be patented.
Yes,
And
exactly.
so therefore,
There's no
we're in a
incentive
loop.
to go through that process to get
No,
it
we're in a
approved.
loop where they say, oh, but it hasn't had double-blind trials. Well, you know, people often are in that mentality where they want to compare one molecule with a placebo. But in traditional herbal medicine, the prescriptions involve many different herbs
Hmm.
to make up one prescription. And in acupuncture, if it's intended to be used with acupuncture, then you can't really take acupuncture away, because it's part of the way traditional Chinese medicine is practiced.
Right.
So, you know, I think one analogy that was told to me many years ago was, in Western medicine, we look at a person like a Model T Ford, and then when we want to we look at a person like car parts,
Right.
like something happens to their knee, we replace the knee like we replace a hubcap. Whereas in traditional Chinese medicine, they look at the person as a whole, what is actually happening in this person
Hmm.
as an individual, what meridians are out of balance to cause this illness.
Hmm.
And this is where the Tomii system will actually look at the person as an individual, just from the acupuncture points, or the points that Dr. Chen has.
Yeah, he uses acupressure, but acupuncture, same principle here, right? Trying to.
That's right. And it produces a traditional Chinese medicine diagnosis, which is not looking at somebody like a Model T, like off the production line,
Right.
but as an individual person. Why is this person fatigued? Why does this person have arthritis? And it will tell a different story to the way Western medicine treats, which is just like, let's just replace the knee and they'll get better, which
And
isn't
Western medicine is
why it
designed.
doesn't work.
I think Western medicine is designed to intervene for immediate results, which is to say, you got a problem, I'll fix it, or I'll cover it up or help you deal with it. It's not designed for chronic, continuing, persistent problems. there is not one immediate, quick answer to why I have a headache or why I can't sleep. It might be my diet. It might be my lifestyle. It might be something imbalanced in my body. It might be lots of things. It might be psychological. It might be mental. It might be physical. And I ain't got time. I got 15 minutes to diagnose it. You know, I got another car parked outside that needs a brake job, that needs a replacement.
Right. Yeah.
And so we don't tend to deal with ongoing chronic conditions very well. We deal with immediate problems that we can intervene and fix. And there's a need for that, but there's also a need for the other. More and more, we're all plagued by these, I call them chronic, persistent problems. They never go away. They persist, and they keep recurring, and they affect your whole lifestyle. Sleep, for example, or upset stomachs or pains or whatever. It affects every part of your life. And that's where I think people are hungry for alternatives, because they're not finding them in the traditional Western system here. And those are alternatives that existed for thousands of years. Similarly, if I have a knee that does need to be replaced, maybe I don't need to go to an acupuncturist or an acupressurist here. Maybe I need somebody to cut it open and put a new one in there. So I think we're seeing in this country a sudden emergence of this term, exactly what you use, integrative medicine, integrating East and West. Here we're at UCI's Applied Innovation Center, here at the University of California, Irvine, big medical device research, medicines, all this stuff. And yet, founded by Susan Samueli, her husband, one of the billionaire founders of Broadcom chips, and she apparently believes in it deeply and has funded an integrative medicine center here at UCI that they've now put into their entire UCI medical system, where you can get acupuncture and other sorts of alternatives as part of your Western clinical approach here. Are you seeing that in Australia as well?
I think that that's happening around the world. And I think that, as I said, when natural medicine has been fantastic at publishing science to prove that things like acupuncture and herbal medicine actually work and why they work, then I think many people have taken it up. And the other thing that I find very exciting is the combination of new technology with ancient practices.
Yes,
for example, right. I'm really interested in sonodynamic therapy, which is ultrasound meets herbal medicine. And
ultrasound, it's like a new movie that we're going to see. Ultrasound meets herbal medicine. Yeah, right.
It's absolutely amazingly effective. And I've just written some books about it that I put on Amazon because I was so blown away I was like searching in the medical literature. What else does this do? What else does this do? And that's a very non-invasive, pain-free, very powerful method, which is just not that widely known.
We had a doctor that's in it, because we have lots of doctors, lots of medical research in this campus, and particularly in this center where we're located. It's trying to develop these new cutting-edge therapies and technologies. And Sonic, there's somebody coming and talking about destroying prostate cancer with ultrasound. Rather than going in and cutting it, they use the sound to destroy it.
It's quite amazing. You don't need to have the surgery anymore because these systems are available and they work. I mean, I've done these treatments myself. I've done, for example, there's an 80-year-old man that had benign prostate hyplasia that had this treatment, and he just couldn't believe it. And I gave him the medical literature to prove this is a thing, this will work.
Yeah, right.
Oh, I don't know. I think I should have the surgery. Oh, I don't know. And we gave it a try and it worked. And what sort of machine was that again?
Yeah, exactly. A little sound wave and it's smashing this in there.
Like, how can you do this with sound? Well, you can. And it's quite amazing. So, I mean, but it also works with cancer, works with arthritis, it works with endometriosis. And I mean, these are the sort of integrations that are happening. Another really exciting one that I've been exploring too is, say, the bee products and some herbs encourage us to grow new stem cells. And many Chinese herbs do this. Wow. So the notion of combining stem cells and bee products is really quite an exciting area.
Well, I'll take you to another level, that there's a company here that's focusing on Lionheart. I forgot what the rest of it.
Lion's Mane?
Might be, but they're actually not just, I've heard of that too, but this is a company named after a guy named Leonhardt, so we call it Lionheart, and they're building some clinics.
Okay.
And it's integrative medicine. And his whole push is, he invented some some heart valves and other sorts of things that brought him fame and fortune. And now he believes that using bioelectric stimulation, I don't know if this works or not, but somehow it's these biosensors that they put on this, like stimulate your muscles to fire and contract and fire and contract. They use it traditionally to exercise, to stimulate, instead of going out and physically exercising it, your body thinks it's exercising because it's contracting and expanding. But he's used that and some other things. He could explain it better than I, but it's stimulation. They think they can grow new heart cells, heart valves, heart things.
It's very, very exciting, very exciting. And actually, acupuncture is a traditional form of electric medicine, if you like.
See, that's what I think in some way, exactly, right?
It's the original electric medicine using your body's own electricity.
Yeah.
So a lot of people don't understand that.
So anybody that says, what do you say to people that say, oh, that's a bunch of hooey, that's old witch doctors from little villages. We're living in the age of modern science. What do you say to people who dismiss this out of hand here?
I seem to spend a tremendous amount of time doing education and explaining these concepts. And I think it's important because people don't know. But I will say, if people are not open to it, you can't persuade them. So
right.
what usually happens is when people hit the wall, when they have a serious illness
exactly.
and they've got everything that failed and they give it a try and it works, they can't believe it.
Out of desperation, nobody else came up with an answer. I'll try anything here. Yeah.
That's really exciting. And so, I mean, really difficult to treat conditions like Parkinson's, MS, arthritis, asthma. These are all easily treated with traditional Chinese medicine and apitherapy. And, you know, combining the technologies, I was saying, sonodynamic therapy. So really, Dr. Chen has given us a gift by bringing these ancient medicine into a high-tech phase.
Yes, exactly.
We can actually show people like who are skeptical, like my Lyme disease patient, that here's a report that says this meridian in your body is seriously out of whack and we can fix that. Mm-hmm. And he's like, this man has been around the world trying to get answers and he just couldn't believe it from a simple little program.
A little wand. I've told my story a million times. I went into Dr. Chen myself. I get treated by him regularly, and I had what I found to be a very painful, very worrisome development. I had this little pimple basically in my lung, a lung nodule, and it hurts like hell when it gets aggravated, which is most of the time. If I get anxious or acid reflux or any sorts of thing, it'll aggravate itself, and it feels like a heart attack. And when I went in, they diagnosed it, gave me a CAT scan, and said, there it is. I said, great, cut it out. We can't go into your lung and cut this little pimple out. Very complicated, very potential risk and everything. What do? Hope it doesn't grow. Hope it doesn't turn into a cancerous thing or something, and live with it. And I said, that's it? And so I went to him at a suggestion of somebody, desperate. Nobody else had no answers. And he said, what's your problem? I said, you tell me. You're the big wizard here. You're going to wave your wand. You tell me what's wrong. He said, okay. It's this little wand. He puts it on these little pressure points. It's connected to a computer. It spits out all this data. He says, well, there's something wrong with your lung. I said, what? How did you know that? Well, so here, it's right here. This is out of balance and out of whack and everything. I said, well, it sure is. And a year of treatment later, folks, I don't know, I maybe this is all in my head, but I went back. The thing shrunk. It went down. It doesn't hurt anymore. So when I had my next year's CAT scan, it isn't gone, but it got smaller, and they went, oh, lucky you. No, I pursued another approach.
Yeah, I think your story is the sort of story we hear all the time, where people, that they're convinced it's not going to work. No, that's not going to work.
Right.
And then when it does work, they just can't believe it. And
right.
I mean, it's terrific that it works, but I mean, it also requires a lot of energy and to keep your enthusiasm up in the face of people knocking you.
Oh yeah,
I get knocked.
I went over and over.
A tremendous amount for doing bee medicine.
Yeah.
but I mean, for example, I had a 25-year-old guy from Sydney he was a professional soccer player in Brazil.
Okay.
And he got a repeatedly busted ankle, and then he had to end his career. And he had multiple surgeries, nothing worked. And he had some treatments with me, which involve all of these modalities we're talking about.
Right.
Also the Tomii system. And he got better. And a week later, he was just messaging me saying, can't believe it, I'm better. you know, and it's all about just a very different approach to how
Yes.
you can. Well, all we're really doing, as they say in integrative medicine, is we're helping the body repair itself.
Exactly.
We're not miracle workers. We're just working with the body's own systems to help the body
And
repair.
why
Because
does
the
that have to be in
body wants to
competition with
repair.
Western medicine? Clearly, Western medicine has its benefits. Replace a heart, replace a knee. But it doesn't have all the answers. It's not just a pill or a procedure. It's a chronic, persistent condition like my nodule or like his broken ankles repeatedly here that
Yeah.
needed a different healing methodology or modality, as you said, than just give me a pill to cover it up or
Yeah.
50 surgeries to try and fix it.
Yeah.
That's what I think is exciting about the integrative approach, and it's being done at campuses like UCI. UCLA has an integrative. We had Dr. Kiki Wee, who teaches on staff at the medical school there and also runs an integrative East-West center at UCLA. They're starting to say maybe there's some benefit to both. Why not add as many tools to the toolbox as we can? And these have clearly been around for 1,000 years. Maybe they're not properly understood. Maybe they're not properly vetted. Maybe they haven't been properly diagnosed and explained. But through work like Dr. Chen, we're starting to see a combination of a scientific approach to traditional healing.
I think that's true. And it is a marvelous tool that he's created, and he's done it himself out of his own need to repair his body, and he's
Yeah,
done that.
right.
But also, he's used that extraordinary skill of being an engineer, and also the dedication he's had to go and actually study TCM in the hospitals in China.
Right.
That's years of study, but then combining that extraordinary traditional knowledge with his high-tech knowledge is a
Exactly.
great gift to us,
I think
because we
so.
can, people like me who haven't been able to spend the many, many years in a traditional Chinese hospital university to learn the pulse diagnosis,
How else
we can
would you
just
do
use
it?
the
Yeah, right.
system to get it to produce a lovely little report that actually does help the patients. Of course, the patients think, what are you doing? What are you doing when you're running a little sensor over different points on their wrist and on their foot? And when they see the report, they're completely blown away.
Yeah,
And
I was. Yeah, there's a
yeah,
certain
it is
validity.
amazing.
It brings it to life. All right. So, last question: Have you've had good results using the Tomii system? Have as you take it to other people practicing bee medicine or Chinese medicine, are they eager, willing to look at this, or did they dismiss? Oh, no, you're just trying to impose Western science into a unscientific traditional approach here. I mean, does the bias work the other way? Do traditional healers scoff at science, or are they eager to find new tools to analyze and help them diagnose?
Well, I think that yes, you're right. The bias works both ways. I mean, I'm the sort of person who likes to bring in if somebody needs to have some healing done, I want to bring in everything. But some people who've learnt one way won't look left or right,
Exactly.
and that happens in any profession. So, and the other thing is they don't go and study. I make a regular effort to jump on a plane and go to a country with my little backpack if I need to learn something.
Right, like
When,
Mexico.
when I when I saw the Russians were reversing Parkinson's with apitherapy, I just emailed the dear professor, could I please come and study with you? Oh yes, people are really happy to train you and teach you, but nobody asks.
Yes,
So, I mean, I
exactly.
found I get points for audacity because I just invite myself now. Hey, can I just come and learn that with you? And they let me, which is amazing. And maybe I get points for being a little Aussie backpacker. But, um, you know, I think you need to be willing to continually learn. And because we've had a century of domination by the drug companies, and say the United States, that we're now having a new era with RFK Jr., where they're saying everybody's
He's going to
sick.
shake things up, that's for sure. Whether you like it or not, he's determined to take another look at all this stuff here.
And he's declared that natural medicine needs to flourish
Yeah,
when, for 100 years since the Flexner Report, natural medicine has been crushed.
yeah,
And
very much so.
and there's been a campaign to make out that it doesn't work, that it's witchcraft and all of that. But where these things are showing that yes, it works, yes, it's proven in science, and people are reversing their health issues. And I'm afraid it takes a tremendous amount of explaining and education. I do a lot of writing, I do a lot of conference talks, because it's important for people to know. And people are always amazed at what I talk about. But I'm often speaking from the research, from the medical, what's published in science, but also from practice and what I've seen
exactly.
hospitals in the
What
world
you're
where
seeing yourself doing, yeah. Well,
absolutely.
we've gone
Amazing.
way over our allotted time here, but I thought this was worth it because you're the epitome of integrative medicine. It isn't just I'm studying one thing, whether it's a traditional method or a modern method, and I'm sticking to it. You're trying to find the best and bring all of those together into a new form, which is, I think, what we're hungry for. I don't want to throw out the benefits of Western medicine, but I don't want to be stuck to their limitations as well.
Thank you. Well, I'm board certified in Canada and the US. So if anybody wants me to come there, I'm very happy to be there. As I
Wow.
said,
Okay.
I jump on a plane regularly. I'm off to Mexico in a few days again.
Do you
And
bring a little box of bees, or do you have to get them here? Or do you have to?
that's always an issue.
Do you have
But
to? Do you have to
there are
book
different,
another little passenger seat for your box of bees here, like you would your pet dog
there are
or
many
something?
jokes about bees in my work, but
Or did they
mostly
just fly along behind the plane and follow you? Maybe they're just
there are
flying.
beekeepers all over the world. There are apiculturists all over the world. So I just plug into that amazing network. But it doesn't always have to be a live bee. There is medicine that's derived from the bees that we
Ah,
can
there you
use.
go. There you go.
Yeah.
Fascinating. Well, how do they find you? How do they get in touch with you if they want to take you up on that and learn more?
I've got a website which is ozlongevity.com.
Oz, like
Oz,
OZ for their slang way of saying Australia, Aussies, yeah,
as in the Wizard of Oz.
right.
And I'm also president of the Australian Apitherapy Association, and I've got a little YouTube channel for Oz Longevity. So I've got lots of videos from around the world on that
Well,
YouTube channel.
I hope
But
you'll add this video to that YouTube channel as well
I would
here.
love to, with your permission, I would love to. So thank you
Absolutely.
so much.
Well,
Thank you so
thank
much
you. And
for sharing.
what a fascinating set. Anything you want to say, Dr. Chen? I know you've been quiet here. I've been dominating the conversation as usual here. Anything you want to add to this here before
Yeah.
we leave?
Thank you. Yeah.
I think, would you be interested in learning more about bees? Like another aspect to Chinese traditional medicine? You're always looking to add new things, like you're adding an herbal practice to it and everything here. I think it all works both ways here. I think we're all trying to bring more tools to the toolbox here. All right. Thank you so much, guys. That'll wrap this edition up here for us. Thank you for joining us here.
Thank you so much.
Thank you. Yeah.